Today, Dr. Oz did a most embarrassing questions segment and gave a few helpful hints. Oz says it's okay to pee in a pool because chlorine breaks down the walls of the bacteria in urine, so it's pretty sterile. That's why it's not visible. Pooping in the pool depends on what the poop looks like. If it's solid like a candy bar, most of the bacteria stays in the poop, so you can just throw it out and raise the chlorine in the pool and stay out for a half hour. If it's diarrhea, there may be viruses and pathogens, so you need to close the pool for 13 hours and raise the chlorine and clean out the poop. For heat rashes, anti-chafing sticks have Allantoin, which reduces friction. If you already have a rash, use calamine lotion. To stop the itching of poison ivy, grind 1 cup of oatmeal in a blender and put it in a lukewarm bath and soak in it for 30 minutes. If the pool turns your hair green, it's because chlorine cracks the hair and copper sticks in the cracks and oxidizes like rust, so it looks green. Cover your hair with 8 ounces of tomato paste, put on a shower cap for 5 minutes, and then wash your hair. Waxing tears off little bits of skin, so do a hard wax because it's gentler on the skin when you rip it off. Wash but don't exfoliate for 2 days. Apply hydrocortisone cream right after waxing, and don't have sex for 2 days because it causes rubbing and chafing. The best way to take care of a North American jellyfish sting is hot water. It slows down the venom secretion. Salt water washes out the venom better, urine isn't effective because it's not very acidic, and vinegar only works in tropical climates. If you're not around Florida or the Gulf of Mexico, vinegar will cause the stingers to release more venom. Then Oz had guest Dr. Justin Piasecki, a plastic surgeon. He reconstructs skin cancer scars, and the procedure is covered by insurance. He says surgery doesn't require taking as much skin anymore. There are 2 types of skin cancer, basal cell carcinoma and squamous cell carcinoma. Both are usually on the face. Basal doesn't usually look like much. It's a discoloration that's usually red or white, but it's changing and may bleed with minimal trauma. It's a wound that won't heal over weeks or months. Squamous is faster growing, usually looks like a wart that is ulcerated and scaly, usually on the face, head, or neck. They're painful and they itch. See your doctor if there are changes in the border, color, or size, an open sore that won't heal, or a red itchy patch. To prevent skin cancer, sunscreen must be broad spectrum. It protects from both UVA and UVB. It must be an SPF of 30 or greater and water resistant for at least 40 minutes. None are towel proof, so reapply every 2 or 3 hours or every time you get out of the water. The best sunscreen ingredients are zinc oxide and titanium dioxide. They are physical agents, ground up rocks, that reflect the radiation. There is sun protection laundry powder. You can add it to detergent when washing clothes. It adds UV protection to clothing, up to 6 times greater protection than clothing normally gives. The EPA UV Index app tells how much UV rays there are at any time, and it's free. To heal a sunburn, skin must be moisturized. Tamanu oil is from a tree nut in Asia. Apply it to a sunburn. It has anti-inflammatory and antibacterial properties. Get the 100%, not diluted with other oils. Then guests from People-Animal Connection discussed how therapy animals make patients happier and healthier. Oz said cuddling increases oxytocin within humans and animals within 10 minutes. This lowers cortisol and other stress hormones. Petting lowers your blood pressure and cholesterol. If you want to help with this, go to petpartners.org to register your dog, and they can put you in touch with local pet therapy organizations.